again, the more you understand stuff, the more you can really apply it without having to be, reliant on prescriptive stuff, right? So, and I think that's the other beauty of it. If the more you understand it, the more creative you can get with it. And instead of just, taking a study and saying, well, I have to push on this segment for 3 minutes for it to work. I think just, again, the more you understand it, the more you say, you know what, there's nuance to it, I'm going to change things up. So I think adding creativity to it and a little bit more nuance, I think is an important thing too.
Today on Hands On, Hands Off, we're diving deep into the cutting-edge world of sensorimotor neurorehabilitation with Dr. Alex Bengtsson, a leading postdoctoral research fellow at Northwestern University. Alex is on the forefront of studying how the brain and the body manage pain, exploring the neurophysiology behind descending nociceptive inhibition, motor unit behaviors, and manual therapy mechanisms, all in one episode. When he's not in the lab, Alex is hands-on in outpatient orthopedics at the renowned Shirley Ryan Ability Lab, treating patients and mentoring the next generation of orthopedic specialists. His work in advanced orthopedic practice and pain neurophysiology isn't just science. It's shaping the future of fellowship education in orthopedic manual physical therapy. So, what can neurophysiology teach us about our interventions and about advancing our profession as a whole? Let's find out with Alex on Hands On, Hands Off. Alex, congratulations.
Thank you.
Talk to us about this award that you got.
It's the Emerging Leader Award, and first of all, thank you to everyone who nominated me, I guess, if you're watching this. It's I guess it's an award for people in their first 10 years of their career who've done certain things for service, for the academy, for the profession. And I'm very honored that I got the award. That's fantastic.
It's good when people get recognized for things, especially early in your career, get prompted for things like that. Who was sort of instrumental? Is there anybody you'd like to, that sort of prompted you to make sure that you continued your work?
There are a few people. I think the first person comes to mind is Dr. Keller Courtney. She's been an inspiration, professionally for a long time, and one thing that always struck me with her is that she was able to combine clinical excellence with teaching excellence and research, frankly, and so it's something I've always aspired to. And then maybe more from a leadership standpoint too. First weekend course in residency, our residency director, Dr. Eric Magrum, told a story about Jim Bazell, who founded our residency, and he passed away sadly, so I never had the chance to meet him. But there was a story that always stuck with me where Jim would take people, new grads, new colleagues, and at conferences would go up to big names and he wouldn't know them, but he would pretend like you knew them, like they're old friends, and just introduce these new people to somebody they wanted to meet. So I always felt that was a nice way to bring people in. So one thing that I always enjoyed doing is doing the exact same thing for students or colleagues, and introducing them to AOMs or introducing them to people around here. And so for me that was always a nice way to give back, because I had so many good mentors in my career and people helping me along. But,
good to see you're still paying it forward.
Yeah, it's something I enjoy, and
fantastic. I'm going to read this to make sure I get it right. Your research focuses on the neurophysiology behind descending nociceptive inhibition and manual therapy mechanisms. Did I get that right?
Yeah.
All
It's
right.
a mouthful, but yeah.
Translate it for people like me. What's that mean?
So the main interest really is looking at what happens in the nervous system. So if you think, okay, you have a painful input or potentially painful input, right? Nociception. The body has the ability to either block that signal or attenuate it, or increase it, right? And in chronic pain, an input that shouldn't be painful oftentimes is attenuated, and a lot of that stuff happens way before we get to the brain. So we're thinking spinal cord, brain stem, right? So that's more the mechanisms I'm interested in, and I think the more we can really pin down what happens in the nervous system with interventions like manual therapy, I think the better off we are as a profession, because we have a better idea of what's actually going on.
Yeah,
right?
Not just know what to do, but know why what we're doing is doing the thing we hope it's doing.
Exactly.
Right,
yeah.
Being able to prove it.
Yeah, and it's a tall order, because there's a lot going on, and in humans, certain things you can't do research-wise, of course, right? But nonetheless, I think pushing forward and just we're standing on the shoulders of giants, especially at AOM, there are a lot of those people around. So I think pushing forward and taking the work that people have done and building on that is important.
Yeah, you got a breakout session tomorrow on manual therapy, specifically graded mobilization, pain neurophysiology. Without giving too much away, but you can give it away. I won't tell anybody. It's not for recording this.
Just between us, right?
Help me understand the neurophysiology behind those interventions, key for practitioners. It's a similar area of your research, right?
Yeah.
That's right down the middle for you.
Yeah, exactly. Yeah, and I have the pleasure of presenting with Dr. Courtney, and that's a very exciting thing for me to do. And but yeah, the idea is we want to combine some of the evolution of manual therapy and development of certain techniques, especially more the Australian approach, and how that really meshes with modern pain neurophysiology science. I'm always careful because sometimes people equate pain science with pain science education or pain neuroscience education. But really we're talking about the study of the neurophysiology. So I just want to make that clear. Anyways, digress a little bit.
Yeah.
But yeah, so the idea what we want to do tomorrow is really bring the clinical piece and then the neuroscience piece together. And the idea is we're talking about cases, we're talking about how some of these techniques evolved and how you grade it and why, and then how that relates to the neuroscience on a little bit deeper level. So zooming into the neurotransmitter level, for example, and taking it right back out and seeing how that applies to the clinic on Monday, right? So we want to make the science a little more palatable for people who aren't necessarily in that world. Because I think, again, if we can raise the level of understanding of some of that stuff across the board, I think that's going to be helpful too, right? Even for everyday clinicians. And up until very recently, I was a full-time clinician too, so a lot of times people ask me, why is this important to me? And I tell people I use that stuff every day in the clinic just to enhance my clinical reasoning. So that's kind of the idea, to pass it on and move it forward tomorrow.
What made you want to take the pivot to go from full-time clinical practice to research? What about that?
I always wanted to have a mix between clinic, research, and teaching, and frankly I didn't really care what ratio.
Yeah.
So there was a point where I talked to Carol a couple of years ago now, and I asked her if there was a way I can get more involved in a department at Northwestern and maybe help with some teaching. And at the time I was already doing a little bit for the fellowship and just started with the residency as a mentor. She set up a meeting with the department chair, who is now my primary mentor for the research, Jules DeWald, and I met with him, and very quickly he told me about this postdoc. And so Northwestern, they created a DPT postdoc. So normally you do postdoc after a PhD or some terminal academic degree, but Northwestern created this position for people like me who want to get into research, but whether it's due to time, family commitments, finances, whatever it may be, don't want to go the PhD route. And that's kind of how it started. Carol, again, as a mentor, saw this opportunity for me and then helped me along and moved it forward. So, it was great.
That's great. Manual therapy remains a hot topic in physical therapy. I mean, obviously we're on the hands-on, hands-off podcast, so we know it has to be a topic. With varied opinions on its application and effectiveness. That's what gets discussed in hallways like this. From a neurophysiological perspective, how do you see manual therapy fitting into a modern pain approach?
Yeah, I mean, it's exactly what we're going to talk about tomorrow. And it's just one of those things, if people don't really understand why it works, it's easy to then say, well, there are small effect sizes, which is frankly true for pretty much every intervention we have, and also for a lot of medical interventions, right? But on social media, a lot of times you see people quoting small effect sizes or, saying things like it creates dependence, which there's really no evidence for that either, right? So it's just one of those things. And just as an aside, I've seen clinics where, patients are just as dependent on somebody else for exercise because they've been there for 12 visits, and instead of being able to do their exercises, they're in line waiting for somebody to tell them what to do for an exercise. And if that happens after 12 visits, they're not doing it at home either. So it's more, I think, more a question of bad management rather than, the intervention itself. Let's put it that way. But I think understanding the mechanisms and why something works and why it may work for one person and not the other, I think that's the important part. And I think that's what's going to help us move forward as a profession. Yeah,
well said. You mentioned moving forward, looking to the future. How do you see fellowship education evolving to include new findings in neurophysiology and sensor motor research? What looks promising in the future?
Yeah, I mean, it's one of those things. I think everybody has their own interests and their idea, and they say, well, this is my interest, so I think this is probably what's going to help move the profession forward, or fellowship or whatever. So I recognize my bias, and I'm clearly biased towards the stuff we've been talking about the last few minutes. So I just want to put that out there. I'm aware of it. But I do think the more we can understand these mechanisms, right, and a lot of times people throw around the term mechanisms and a little bit loosely, but I'm really talking about what happens at at a neurotransmitter level. How do systems change? How do things like synaptic density, a dorsal horn, for example, how does that change? Like real physiological changes. Again, I think it's relevant, and not everybody has to know it at the deepest level. That's not what I'm saying, but I think general understanding of that is really. I think it's going to make it easier to figure out how to treat, how to dose, who is appropriate for the treatment, right? Whether it's manual therapy, exercise, TENS, whatever it may be. And again, same thing with TENS. I think that's gotten poo-pooed for a long time too. Can I say that on the podcast?
You can.
Okay.
It's allowed.
Cool. I just want to make sure. I have an 8-month-old child now, so I want to make sure I've adjusted my vocabulary a little bit. I guess. No, but TENS has been looked down upon for a while too, and I think some of it is. Maybe not having the right equipment. Some of it is also maybe not applying it in the right way. And it's the same with manual therapy. So I think again, the better we understand it, the better treatments are going to be.
Yeah. Beyond your research, you work directly with patients in outpatient orthopedics. You said you wanted a mix of research and teaching and clinical practice. Not necessarily didn't know what ratio you wanted.
Yeah.
But how has your research influenced your approach in clinical practice? How has it worked that way?
Yeah, and I think that's the thing. So especially when I did the fellowship with Carol, a big focus was on the neurophysiology, right? So even from there, I already applied a lot of it to patient care, and I think that's what helped me grow a lot during that fellowship. And then now with even deeper understanding as I go through the postdoc, I think it enhances even more. So I think just having a better understanding of saying this patient may respond a certain way, and even though this patient seems like this type of fibromyalgia patient where you can't touch them at all. If we figure out just the right dosage of maybe a higher intensity intervention, we may actually be able to make a change. Again, I think it's just taking it to the next level. In short, and so I've had I think even more successes with that. The more I understand this stuff. So again, that's where I think my bias comes from. I think this is one thing I would like to push. And then there are a lot of other things, communication and, a lot of psychosocial stuff. And, I think that's important as well. But, again, this is my bias. This is, what I think is important. And I don't think it has to be mutually exclusive. Sometimes there's a dichotomy that people perceive that you're either a good researcher or you're good with science or you're a good clinician. And I think that's, it's silly that people insist that it has to be a dichotomy. I think you can well in all of those things.
Yeah. All right. Last thing we do on each episode is called the parting shot. Is there an idea, concept, a quote, something you'd want to leave as we wrap up for the audience?
Oh, it's a lot of pressure.
It's a little bit of pressure. You could even repeat like an idea or concept that we've talked about today. Anything that you want to leave with people? Again,
the more you understand stuff, the more you can really apply it without having to be, reliant on prescriptive stuff, right? So, and I think that's the other beauty of it. If the more you understand it, the more creative you can get with it. And instead of just taking a study and saying, well, I have to push on this segment for 3 minutes for it to work. I think just again, the more you understand it, the more you say, there's nuance to it. I'm going to change things up. So, I think adding creativity to it and a little bit more nuance, I think is an important thing too.
Congratulations again on the award.
I appreciate it.
And appreciate you sitting down with us.
Yeah, of course. Thank you for your time.
Thanks, man.